Good morning, ladies and gentlemen. Yes, I'm very happy to have a chance to share with you some of my experiences and insights gained from providing psychological care to breast cancer patients and survivors. I feel very grateful and privileged to be involved in providing psychological care for breast cancer patients since the inception of Breast Cancer Foundation from day one. And during the process, I learned a lot, and then I try to keep up with the current practices of psychological care by adopting as many evidence-based psychological care and services to the patients and survivors, because there are so much research and knowledge gleaned from a large amount of studies. And there's always new information, and I'm very glad that I would be able to make use of those new knowledge and information to apply to work with the cancer patients and survivors. Okay, at the very beginning, when they are first diagnosed with breast cancer, the psychological reactions are very similar to other patients when they first diagnosed with cancer. You know, like the very initial reaction would be shock, disbelief, and feeling that they are unfair, because they all feel that they are good people. How come they got breast cancer or cancer? And of course, there are worries about the future and also the fear of mortality. These are all very common reactions after diagnosis of cancer. However, for breast cancer patients, because of the arrangement of treatments and the availability of many treatment services, and the side effects, undesirable side effects of these treatments, breast cancer patients, they tend to experience a lot of changes in both in terms of their body as well as in their psyche, in terms of dealing with the aftermath of the diagnosis and from the treatment side effects. For example, many of the patients have to go through surgery, and then chemotherapy, hair loss, and also the loss of the breast, and sometimes it's the asymmetry, and sometimes it's the scarring, and then premature menopause, and then the sense of femininity would be very challenged. Many of the initial reaction would be like, how could they face themselves after treatment? And of course, the body image, like what Kelly suggested before, even the edema, it really altered the body image, and many patients suffer from various degree of body image disturbance. Okay, and what is body image? Okay, and first of all, it's the alteration, but then before all that, there is a huge sense of loss. And then that loss would, for some patients, they interpret that kind of loss is they couldn't understand why it happened, but then they feel that they somehow, after the loss, and they feel that they experience a sense of failure, that somehow they fail themselves by getting breast cancer. And then this, because in some situations, when they first got the diagnosis, some patients told me that when they walked out of the doctor's clinic, they felt that from now on, I'm different from the rest of the population. People walking on the street, I'm no longer one of them. I'm not normal, I'm not healthy, and that's the initial reaction. And then later on, compounding that with the side effects of treatment, they really, they experience it as a kind of assault on their bodies and on their sense of self, okay, on their identity. And this body image disturbance it could last for a period, or sometimes it could last for decades. Because just a few weeks ago, I heard from a long-term survivor. On the surface, she was coping very well, resuming work, approaching retirement age, and then she raised the children and everything, okay? But then she revealed that she's still unable to change her clothes in the same room as her husband when he's in there. She always have to close the door, okay, in the bathroom to change her clothes. Although on the surface she really appear healthy, happy, normal, and fully recover. And then I realized that really the sense of loss, the sense of loss of identity, the sense of loss of the integrity of their body, it really could be very long-term. Okay, body image is a kind of, not just how you look at your body, but how you make sense of the sensations, the shape, the appearance. Of course, our bodies are always changing, right? As we age, our bodies change. But then this negative body image is like because of various reasons, and in this case, because of the surgery and other treatment, they don't feel comfortable under their own skin. And because of that, and then they carry their body with them 24/7. So that really would bring on various degree of psychological impact, affecting not only their sense of self, but then their overall mood, okay? And because if they feel that there is a deep sense of loss, depression would come in, and then anxiety, because there's so much to worry, not only the prognosis, but also how they would adjust to living with and surviving breast cancer. There's always some doubt. And then they said every time they go for their assessment or checkup, they feel that they are going to get their report card, and then they would lose sleep for a night or two beforehand. And that's always hanging in there, the anxiety about the uncertainty of the future. And then there is this sense of shame. And because I heard from a few of the participants in the support group that I run with the nurses, the participants are very open. They learn to be very open and trusting of each other, and they tend to be very straightforward in explaining, what bothers them. And then one patient, again, on the surface, she recovered very well, amazing. And then one time she just blurted out, 我覺得自己好樣衰啊. They feel ashamed of their body, feel ashamed of the changes. And then, of course, there's anger, because they could not figure out how things like that, this kind of assault would happen to them, to their physical body, to their health. And of course, with the lingering adjustment and adjustment in every aspect of their lives, and there's always this sense of distress, but on. And then for some, because they are so negative about all this impact. Sometimes they wonder if they should go on with the treatment protocols, because a lot of times we in the groups we always suggest, hey, we need to balance the treatment benefits with the side effects. But then there are always a few participants, they felt, I wonder if it's all worth it. And then there's some once in a long while, there are patients who would just leave everything, chose to stop all the treatment protocols recommended for them. And of course, if that happens, it affects their health outcome. And then they just left the scene, and we would really worry about them. And then this body image disturbance. It affects how they see themselves, but it affects their mood, but it also affects how they relate to each other. Because of this sense of inadequacy, a lot of times they would, especially in the first couple of years, they would distance themselves from friends, from peers, because they don't want to reveal to others what they have gone through and how they have changed. And because it changed their sense of identity, they feel that they want to, it's safer to isolate themselves. So very often they kind of just stay away from previous contacts, stay away from previous activities, and it really affects their social relationships. Of course, the social relationships also relate to their intimacy, their sexual relationship with their spouse. And a long time ago, I ran a support session for spouses of breast cancer patients to see their concerns and their needs. These husbands mostly. These husbands are very, they came to the group and they're all very caring and protective. And then they realized that the spouses are different, and they become the survivors became very hesitant about having intimate relationships, especially about initiating contact. And then the husband, they reported that they dare not do anything because they worry that if they say something, do something inappropriate, it would bring on more harm and worry, negative impact on their spouses. So they would wait and be patient and hoping the patients would give the initial act or steps to show that they are ready for intimacy. But all of them said is not forthcoming. And then from some cases, we learned that if and when the husbands are very reassuring, telling them right off the bat that you are the same, the change in the breast doesn't mean anything, and then we'll go through it together. When the husbands are able to be so willing to take the initiative to broach the subject, it became very helpful for the spouse to deal with this body image changes. But most of the husbands are too protective to take the initiative to address the issues. And then the wives, they are, because some of them, it took them years before they are willing to look at the mirror when they take a bath. And then, of course, it's something so private. They don't have a place to to share this difficulty and how it had affected them. So again, they tend to suffer in silence, and they feel that is something that they need to endure. And affecting the relationships, intimate and social, and then overall, the quality of life, because they feel that there's something about them that make them not measure up to other peers, that there's something wrong with the body, and overall, their quality of life suffered also. Okay, let's see. Yeah.
Maybe just put
This one, okay. All right, and let's see, negative body image. And then there's a tendency for, because how they interpret the diagnosis of breast cancer and the treatment and its impact, it really affects their emotion. But then there's I observed, and then it was not 100% validated by research. They also found that there's a tendency, but then it's not proven yet. Okay, I observed that many breast cancer patients, they tend to be, they have a certain kind of personality or character tendencies. For example, I observed them to be very dedicated. They are very serious. They would always like to do a good job, and they have a perfectionistic tendency. Once they involve in something, they would do a good job, and they don't mind putting in long hours, extra work. But then, okay, and sometimes I wonder, and I explore with them, where does that come from? Okay, is it really they are just so generous and so willing to help? Okay, what are the ulterior motive? Okay, and it's only through a lot of talking, exploring, and like soul searching, they recognize that, hey, maybe actually I'm doing it for some inner needs. Because many women are caregivers, and then I see that there's a strong need to be needed. They are happy when they are needed, when they could help people, and so this makes them feel that they need to do extra work so that they prove that they are good providers, and then also because they feel that for one thing, they need to prove themselves that they are good. Another need is to show that they are needed by those in the family, at work, and this need to be needed is very subtle. And so it's really, they need to understand what really drives them to be so harsh on themselves. And then because in the interpersonal relationships, they don't want to hurt others. So they would really have a tendency to suppress negative emotions. They don't want others to see them as creating trouble. They just want to be helpful. And then in that way, they put in a lot of effort to really control and suppress unpleasant emotions. because they don't want to be a burden to others. And then it's very hard for them to receive help and support from others. And in that way, they tend to have a habit of really hiding their own needs and emotions. Sometimes to the extent that if you ask them, who are you and what are your needs, sometimes they just give the most superficial. I want to be helpful. I want to be a good caregiver, because most women are caregivers. And because of that, it could mean that they really hide or put away a lot of their negative emotions or their needs or their worries inside, and they are not very good at regulating their emotions. At times, they could not tell you exactly how they are feeling, and then the most common way of dealing with their emotions is to kind of in denial, or just kind of create some distractions for themselves so that everything appear on the surface. They are all okay. And after the treatment, many of them, if you ask them, what are your top worries? Many of them would say, fear of this recurrence, because they feel that it could come back, and it could easily come back to me, and there is no way I could do anything to not to prevent, to lower the risk of its coming back. And because of the changes in their body, they become hyper vigilant about any changes in sensations in their body, when those sensations could be just normal, things, they come and go. But then breast cancer patients, they become very alert, and they would interpret any kind of small changes as the possibility of cancer recurring, and that really put them in a constant state of anxiety, and again, because they could only share this with other co-patients, other group participants. They in their home situation or in the work situation, they become very uncomfortable with the changes in the body, and then they don't know what to do, and then I think among other things, add to the common occurrence of insomnia, or at least sleep difficulties, because in the daytime they keep themselves very busy caring for things, doing things, but at night, when everything is quiet, they could not distract themselves anymore. Then all these worries and negative thoughts would surface, and then it would affect their both the quality of sleep as well as how much they could sleep and rest. Okay, so because I see that the emotional dysregulation is a major factor affecting the mood state, affecting their relationship, affecting their quality of life. So a lot of times I would focus on, when I run the support groups because there are different, as Kelly introduced, there are different different groups, like newly diagnosed patients who are 45 and older, and then younger patients, newly diagnosed, and then recurrence group, and then advanced group. And I feel that across the board, a lot of times they have this difficulty with regulating their emotions, like adjusting to different changes and their emotional adjustment, the coping. Cognitive reappraisal is like a very common, very well-researched way of helping us to deal with our emotional upsets. Like changing our mind about or changing our interpretation of things that upset us. Okay, that's so 轉念, changing our interpretation is very important. The second is emotion expression. And then for the body image disturbance, this would come in very helpful, the cognitive reappraisal, because they see it as all negative, they see it as loss, they see it as it's the end of the world, and from now on my life would be very different. So before we could do any cognitive reappraisal, because a few weeks ago, I taught the CBT, cognitive behavioral therapy techniques, to a group of patients, and it was very well received. They learned it, and then the follow-up session, they were able to tell me how they are applying that to help themselves. But then, because it's in a group, so they are all among their peers, so they feel that they are learning the same time. But then before the actual teaching of the cognitive reappraisal, a lot of times I teach the mindfulness and acceptance approach, because again, very recent research always suggests this mindfulness is important. Mindfulness meaning to help them be aware and accept the present state. Do not judge, do not reject, do not fight with it, because when they learn to be more mindful, then they acquire a moment of calmness, so that they would have the energy and the perspective to really look into the problem and learning how to deal with it. Okay, so the mindfulness and acceptance is almost like a precursor of helping them to change their mind. Body image flexibility, because they feel that, especially for those who really treasure their appearance, they felt, it's the end of the world for me. My old self is gone. But then helping them to look at, hey, the body image is the appearance, and as we age, it will change anyways, and teach them to be more flexible, but their way of tunnel vision, they feel that it's not the same, is not good, and it's just like a piece of paper with a dot in there. Okay, for most of you see that it's a piece of white paper, and we could make use of it. But then for those with very pessimistic outlook, who wants perfection, they would look at this dot and really say that this is really troubling me. This is not good. This is I get upset with it every day. Okay, so there is this approach called set your body free. Like really expand your sense of self beyond your physical appearance. That we would like help them to really appreciate and be grateful about that. They can start rebuilding their health. They could really, in the future, they can learn to live in a healthier way and focus on the quality of life instead of just a damaged body. And another important thing is like, because a lot of times they are caregivers, they want other people to be well taken care of. So the idea of caring for themselves, being compassionate to yourself, to your body, to who you are, is very important and liberating for them. And then they once learn that, yes, I'm important also, they would really appreciate taking measures to take good care of themselves. Emotion expression, okay, because a lot of breast cancer patients, they have a tendency to suppress their emotions, and especially after their diagnosis, they feel that they don't deserve to really talk about their problems. And then, especially in a group situation when they sense support, and then the support and care serve as a grounding base. And with the mindfulness practices, they are willing to explore talking about their emotions. And talking about the emotions, also I would suggest them that's the only way you help other people to understand who you are, what you are going through. And so in a group situation, they have many opportunities to really start practicing expressing themselves and then hearing other people out. And instead of feeling the need to care for others, they, the mutual communication is very important. This is the power of professional-led support groups. I feel that, for me, that's the most wonderful support modality for our patients and survivors, because in there they feel that it's a safe space, okay? Because in there they feel that everybody are going through similar experiences on the same journey. And then in the group situation, they felt that they are not alone and they don't need to suffer in silence. It's a place where they really readily could share and bond with others. And whenever they're willing to share with their experiences and emotions, they feel that more often than not, they are resonated by other participants. And because like expressing, telling them that it's important to be comfortable to express their emotions, they need a place to practice. And then when they see the group as a safe space, they would observe. And then when somebody comes straight out and really talk about that, express their emotions without actually just talking about your emotions, you can't go wrong because you are talking about themselves. You are not hurting others. For them to understand that it's perfectly okay to learn to express your emotions, especially in an assertive way, negative or positive emotions, actually it really doesn't matter. You don't need to differentiate. And then because if you just leave them by themselves, sometimes they could come up with a lot of negativity, a lot of pessimistic thinking and worries. But then with the professional there to facilitate and guide them, so that we would emphasize that actually it's not the outcome that matters, it's the process. It's not the incident of breast cancer that matters. It's how you learn, how you could develop, how you could see a bigger picture of what your life is about. In that way, it really helped them to have a chance to learn to survive the cancer journey and to recover and to thrive. Because a lot of times they would share how that was the best way towards living a healthy lifestyle, so as to lower the risk of recurrence. And they feel empowered by sharing their experiences and learning from others. Yeah, that's all my presentation. Thank you.
Thank you, Dr.